he did not like the idea of being tested, especially not in front of his mother-in-law and the family. 10 years is a lot of time, and a lot of time to carry such a heavy burden alone, broken, blamed by everybody, and to see a doctor. For men, I'd like to just focus on this point. If you have any kind of erection problem, ejaculatory problems, any kind of sexual problems in your relationship, any pain or discomfort in the testes or scrotum area, or inability to conceive after many proper attempts, please seek out a urologist.
Assalamu alaikum. Today we have with us Dr. Amina. We'll be talking about male reproductive health, which is a very less talked or less discussed issue, but extremely important. So I welcome you, Dr. Amina, on the behalf of Team Pro-Choice Pakistan. Our respected guest today has completed her training from Karachi Baqai University, and these days she's working at Benazir Bhutto Hospital and completing her FCPS training these days. So Dr. Amina, let's talk about male reproductive health. And starting with our first question, I would like you to kindly elaborate the issues that males usually face regarding their reproductive health, starting from the very basics. Can you please explain them for our audience?
Okay, so Assalamu alaikum. Thank you much for inviting me today as a guest to be part of such an important message, the topic of male infertility. Health professional myself, I deal with a lot of infertility issues, especially relating to women. And I can see the heavy load that it has on women that they have to carry alone, unsupported and shamed. Well, in reality, half of the time, the male infertility factor, it contributes to a big chunk of these problems. But because of the stigma around the male infertility, it's rarely addressed until the very end, when the female has to go thoroughly tested and given medications for years and on. So I'm very glad to be here and address these issues and try to shed a light on this topic. So regarding to your question about the common issues the male infertility includes, these could be regarding impotence, that is the erectile dysfunction, which is very common. Basically, it is the failure to perform or maintain an erection during a sexual activity. This can be either due to psychological factors, physiological, or even both. Another common problem is a decrease in the sperm count that can be an issue in infertility. And this can decrease the chances of conception. Well, a normal sperm count would be somewhere between 15 million to 200 million of sperms per ml of semen. And this can also be decreased because of many issues the men could be facing, like is basically in layman terms, the veins around the scrotum becomes dilated and it looks like a bag of worms. So a lot of men are ashamed to present to a doctor for this problem, even though it is one of the most common cause of decrease in the sperm count, which in return leads to infertility. And another common issue faced by them are decrease in their testosterone level. That can be also known as hypogonadism. So as we know that testosterone is one of the main hormones in males, like estrogen is for female, testosterone is for male. So it helps a lot in their reproductive health. And it can either be reduced due to congenital reasons, जैसे कि पैदाइशी बीमारी कोई होती है, reasons, या तो it could be due to because of stress, it can be due to lack of proper sleeping, it can be due to some disease that is temporarily affecting the level of the testosterone being released. And there are some very common cause to decrease in testosterone levels that needs to be addressed, such as steroid injections that a lot of these bodybuilders are injecting for developing muscle mass. And these steroids levels counter decrease in the level of the testosterone, and in turn affecting the fertility of these men. And another common problem that could be faced by men is something called Peyronie's disease. ये ऐसी एक बीमारी है जिसमें painful erection होता है और curvature of the penis because of the repeated trauma that can be during sexual intercourse, athletic injury, or any accident that can happen repeatedly. And it can be a very painful condition. So another problem that is commonly faced is testicular problems. That is, can be testicular cancer, or it can be something called hydrocele. Basically, a hydrocele एक condition है जिसमें testes के इर्द गिर्द जो गिशा होती है, layers, that is filled with water. उसमें पानी आ जाता है, and there is a swelling around the scrotum. And a lot of men are embarrassed to check a doctor until it's way late, and it leads to permanent damages in the production of this sperm. And not to make it too long, another common problem is retrograde ejaculation. We may have heard about it, but basically it is when this semen, instead of going down through the tip and getting ejaculated, it goes retrograde into the bladder. As we know that the urethra is in the males is used for urination as well as ejaculation. So the bladder is basically attached to the penile shaft. So instead of the semen getting out, it goes inside, and they face with a lack of ejaculation, and in return leading to infertility issues. And lastly, one of the most important causes that I want to address is a chromosomal disease also known as Klinefelter syndrome. This is a condition in which a male has an extra X female chromosome. So instead of having an X and Y, they have XXY, basically an extra female chromosome. Now, from the outside, the appearance of these men will be like men. They will have a testes and the normal reproductive organs. However, the testes will be very small, and they will have a feminine touch to them. They will have breast tissue development, they will have long arms and legs, and a fat deposition in a female pattern, hair growth in a female pattern. There will be lack of much coarse hair like men, lack of beard. So they will be like a feminine kind of male. And because of these issues, their testes will be underdeveloped. And these men then face infertility issues. The main issue about this problem is that it's very common, but a lot of men, they are very ashamed or shy to present to a doctor in fear of being labeled less of a man. So yeah, these are some of the very common problems that are attributing to the male infertility.
But in Pakistan, I think we have, you are saying that these problems are common, but what I have heard, or many of us heard, has been the erectile dysfunction as the most common problem. So many people do different tricks or different things they try to solve this issue. Can you tell us the treatment to solve some of these problems, particularly erectile dysfunction?
Okay, so basically, if we want to understand how to address this problem, we need to know why this problem happens. So erectile dysfunction is basically the inability to maintain an erect penis. In other words, penis fails to become or stay erect throughout the sexual activity. And the mechanism of how an erection happens is basically due to a complex interaction between the nervous system and the blood vessels with the penile tissue. So basically, the brain sends signals to the penis during the arousal or any sexual activity. This leads to dilation of the blood vessel. The blood vessels around the penis, they get dilated, and there is increased blood flow to the penis, which in return it gets engorged and enlarged. Now, the blood flow is allowed, but the blood return is blocked. This maintains throughout the erection process. Now, we know that it all has to do with the blood vessels around the penis. That's the very important point that we need to know about erectile dysfunction if we want to address issues regarding them. So as we said, it has a psychological, the nervous system part as well as the blood vessel part that is interacting together. So if the cause is related to blood vessels, one of the causes, like common causes of erectile dysfunction, is a disease called atherosclerosis. Basically, that is in this disease, there is damages to the blood vessel. And because of these damages, there is failure of these blood vessels to dilate properly. And another cause that can lead to blood vessel problems is patients with diabetes. Diabetes affects, one of the most common side effects of the diabetes in late stages is erectile dysfunction because of the blood vessel damage. So other factors include alcohol and smoking, sleeping disorders. So these all in turn, one way or another, affect the dilation of the blood vessel, in return causing erectile dysfunction. One of the other factors includes medications, such as medicine one would take for heart conditions such as beta blockers. It's a common medication that is taken by a lot of patients, or a lot of our main population. It comes by the name of Indrol. We may all have heard about it. So one of its side effects is that it causes erectile dysfunction. So this is the factors relating to blood vessels, which I addressed. So factors relating to nervous system or psychological factors then in turn also then inhibits that nervous signals that is reaching to cause it to start the process of erection. So those would be anxiety, stress, depression. This severely affects the whole process of the erection, and it is one of the most common cause in our population, leading to problems in the relationships later on. So if we talk about the treatment, we need to know about the cause that is leading to erectile dysfunction. Once we know the exact cause that is leading to the erectile dysfunction of that person, then only we can start to treat that case. One of the very interesting facts about knowing the cause of the erectile dysfunction, whether it is some kind of organic or physiological cause that is disrupting the mechanism of the erection, or it is a psychological cause, the differentiating fact would be the spontaneous erection, to check for the erections that happens during sleep or early morning. If a person is having normal spontaneous erection during sleep or early morning, that means that their physiology is perfectly fine. Their erectile dysfunction is purely due to stress, anxiety, and depression. So if the patient is also having reduced in spontaneous erection in sleep or early morning erections, then the cause is due to some physiological reason. That could be diabetes, trauma to the penis or the spinal cord, even obesity. Severe obesity can lead to erectile dysfunction, as it leads to decrease in testosterone level. It is proven in the research that obesity leads to decrease in testosterone level because of excessive fat tissue. And again, other causes such as smoking and alcohol. So basically, my point was that knowing the cause, then we get to do the treatment of that. But if we come to the specifics, if we come to the specifics, like what is a specific treatment, then it can be either medication, such as Viagra. We have all know about it, the blue pill. It is basically sildenafil, an enzyme that it blocks an enzyme, therefore helping in increasing blood flow to the penile tissue. And there are also some formulation of injections available that can be injected to the base of the penis, helps in the erection. And newly, there is urethral suppositories. It is basically placed in the urethra. Within 10 minutes, it causes an erection that usually lasts for about 10 minutes. So these are all the basic treatments. There are expensive treatments that are not available here, such as penile pump. These are kind of suction pumps that drains the blood into the penis and causes an erection. And the last resort of surgery, where penile rods are placed into the penis. But those are not commonly sought after in our society.
Right. So does erectile dysfunction affect potency or infertility, or fertility level of sperm count?
Okay, that's a very good question. Now, a lot of men in our society, they do not differentiate between sexual inability and infertility because of sperm abnormalities. So they could be two separate things. A person can have a normal semen sperm analysis. The whole report could be completely normal, but at the same time, they can have erectile dysfunction. So basically, erectile dysfunction is a kind of failure to perform sexually. It does not mean that the person have any kind of sperm abnormalities, though both could coexist with each other, but it's not related that, okay, they has to be together. So the sperm count, basically, they're total different entities and they're not necessarily affected by each other.
Right. सो चूंकि हमारे यहाँ यही तो प्रॉब्लम है कि जो लोगों के पास अंडरस्टैंडिंग लेवल है, या कह लें कि रिप्रोडक्टिव हेल्थ के अराउंड जो टैबू है, जो हुश हुश है, क्योंकि डिस्कशंस नहीं होती तो लोगों को इतना ज़्यादा आइडिया नहीं है, और जो चीज़ें वो गूगल करते हैं, थैंक्स टू गूगल के अब तो फिर भी कुछ ना कुछ अवेयरनेस हो रही है स्टार्ट। लेकिन इससे पहले अगर आज से हम 40-50 ईयर्स पहले चले जाएं या उससे भी पहले, तो तब तो ये चीज़ें जो थी वो ऑब्वियसली, एक तो इनकी गिर्द बहुत ज़्यादा शर्मिंदगी का एक पहरा था, दूसरी चीज़ ये कि लोग डिस्कस करते हुए घबराते थे कि ये उनकी मर्दानगी के खिलाफ बात हो जाएगी, या कह लें कि वो अपने आप को खुद ही लेसर मेल लिस्ट में ले आएंगे। सो चूंकि अब हमारे पास टेक्नोलॉजी है, और चूंकि नए से नई दरियाफ्तें हो रही हैं, तो आपने बात की है साथ में ट्रीटमेंट्स की, तो स्पर्म काउंट और इनफर्टिलिटी जैसे जो इश्यूज हैं वो जरूरी नहीं है, जैसे कि आपने कहा कि इरेक्टाइल डिस्फंक्शन के साथ रिलेटेड हो, एक साथ ये एग्जिस्ट कर सकते हैं, लेकिन इनका आपस में ऐसे कोई लेना देना नहीं है। सो डॉक्टर, इसी नोट पे क्या आप मुझे ये बता सकती हैं कि इज इट नेसेसरी दैट लो स्पर्म काउंट इज एन इंडिकेटर ऑफ impotency?
Well, for impotency, is low sperm count does not indicate impotency, because as I said, a sperm analysis or low sperm count is basically related to the function of whether there's enough sperm produced by the testes, and the whole function of the penis that is causing erectile dysfunction, which is impotency, is then a whole another entity, right? So for a proper fertility, the sperm does not need to only be healthy and of good quality, but should have a proper count and motility. So there should be not only quality but the quantity as well. So in fact, yeah, a low sperm count can be a cause of infertility, but how it leads to infertility, or why is it regarded as part of infertility? Because as we know that the whole process through which the sperm reaching to the egg, it has to pass through certain barriers, going through the vagina and then to the cervix and the uterus. That is the different parts of the female genital system or the anatomy. There are different hurdles that further reduces the count. So due to the hostile environment in the vagina, the pH, some of the sperm already dies out, and then the other half gets detracked till they reach to the main egg. A lot of them have already died out. So if the sperm count is low, then already majority of them will either detract or die out. So most of them will not even reach to the egg. So that is how the low sperm count will then affect the infertility. But impotency or the erectile dysfunction is basically failure to perform. If you cannot deliver the sperm to the proper place, then how will the rest of the processor start? So that's basically how it should be differentiated.
Right. So I think हम ये कह सकते हैं कि लो स्पर्म काउंट एक नॉर्मल चीज है और इसका इम्पोटेंसी से कोई ज्यादा लेना देना नहीं है। लेकिन हाँ, फॉर अ वुमन टू बी एबल टू कंसीव, अगर वो किसी एक ऐसे शख्स के साथ सेक्सुअल एक्टिविटी परफॉर्म कर रही है जिसका स्पर्म काउंट लो है, तो उसमें एक फैक्टर्स दोनों साइड से आ जाएंगे कि स्पर्म काउंट लो होने की वजह से, और फिर वेजाइनल एनाटॉमी में प्रोसीड करने के लिए जो स्पर्म को मेहनत करनी पड़ती है, या कह लें कि जो एक नेचुरल प्रोसेस है वो फॉलो नहीं कर पाता स्पर्म। सो इस वजह से इनफर्टिलिटी एक आउटकम हो सकती है इस चीज का। मैं ये पूछना चाहूंगी कि क्या ये बात दुरुस्त है कि एज के साथ स्पर्म काउंट कम होता जाता है, या ये जेनेटिक?
Well, yes, ये बात बिल्कुल दुरुस्त है कि एज के साथ sperm count decrease हो सकता है. And the thing is कि sperms are made under the influence of testosterone, और एज के साथ एक natural decline आता है testosterone level के साथ. And this is one of the main reasons. It is not as drastic as us female are going through it, but for men, yeah, it is also leading to decrease in the sperm count as the age grows. Even research have shown that there is a decrease 1 to 1.6% per year in the sperm count.
So it's safe to say कि एज के साथ मेल और फीमेल फर्टिलिटी लेवल दोनों में कमी आती है। मतलब कि हम सिर्फ ख्वातीन के लिए नहीं कह सकते कि एज के साथ इनकी फर्टिलिटी में कमी आ रही, बल्कि this is true for men. Right.
Yes, this is one of the misconceptions that needs to be addressed as well.
Right. So thank you, doctor, for clearing this. I would like to ask you another question. Hormones in women are often attributed to be a cause of mood symptoms or acne or other physical problems. So do men face irregular hormonal issues? And if so, how can they be treated and how they affect their reproductive health?
Okay. Yes, to some extent, men also experience hormonal imbalance, but usually it is not in the same clinical picture as a woman would. As I said, for women, it affects, we depend a lot on these hormones throughout our cycle, and eventually it causes a lot of disturbances in our mood and all that. But in men, there can be imbalance of hormones such as testosterone, even estrogen and prolactin. That is another hormone that is very important for reproductive health. And the decrease or the imbalance in these hormones leads to changing or affect their moods, their sexual drive. Low testosterone can even cause depression in men. And even it was speculated that men also undergo andropause. Andropause, basically, that is like counterpart of menopause in men. So that is the andropause, yeah. So this can result in a lot of cognitive even decline in men, that is in their memories, in their functionality as they age above age 40s and 50s and 60s, so on. Now, the question regarding how to suspect, how to know if they're having a hormonal imbalance. Now, one of the important things you need to know is that these declines or imbalances usually show at the age of 40s and 50s in men. And these can be noticed by symptoms such as having low sex drive, difficulty in getting erections, or erections that are not as strong or does not last as long, and lack of energy throughout the day, depression, irritability, and mood swings. This is very important, and as well as loss of strength and muscle mass, as well as increase in body fat. This in some ways are even related to midlife crisis in men, because at that stage slowly the testosterone levels decreases, and because of these imbalance they start to face all these kind of issues.
Right. Thank you, doctor, for clearing this too. Just a quick note for our audience के इस सारी डिस्कशन का मकसद ये है कि आप अपने हेल्थ रिलेटेड इश्यूज को, पर्टिकुलरली रिप्रोडक्टिव हेल्थ रिलेटेड इश्यूज को एक फैक्ट्स की लाइट में जांचें, मिथ्स और जो कहीं सुनी बातें हैं उनके ऊपर ना जाएं। और क्योंकि ये रिप्रोडक्टिव हेल्थ भी आपकी बॉडी की हेल्थ से जुड़ी हुई है, तो उसको किसी भी ऐसी बीमारी की तरह ही ट्रीट करें जिस तरह आप बाकी बीमारियों को ट्रीट करते हैं। तो थैंक यू डॉक्टर अमीना फॉर क्लियरिंग ऑल दीज issues and making all those statements so that our audience knows what they need to do. So doctor, I would like to ask you the next question. That will be, how do men find treatment for low testosterone levels, and how is it that these low levels affect men's health? What kind of doctor they can find to help them, and what could be the lifestyle changes that they can adopt to fight these low testosterone levels?
Ideally, the doctor, the specialist, that is usually a urologist, that should be consulted for any concerns regarding men's reproductive health. So urologist will be the doctor to visit. There is actually another subspecialty called andrologist that is more specialized specifically to male reproductive problems. However, they are under the same domain of urologists, but they are not many common in our area. So basically here you would find the urologist addressing the problems of male reproductive problems. And so you would visit for the treatment of testosterone. They would prescribe either medication that is in the form of injectables testosterone, or even a testosterone patch can be used, or testosterone gels can be applied on the skin, that is absorbed from the skin. But the care should be taken in case of a gel application, because if you are in contact with another person, they can be it can be transferred into their skin and absorbed. So that is not usually given to a lot of people. Commonly used is the injectable form and the testosterone patches. As to what would the low level of the testosterone cause? As I said, with age, to some extent, the testosterone level decreases in men. And as I mentioned some of the symptoms before, it would be exactly like that, reducing the sexual drive of these men, affecting their mood, and they'll be irritable, depression, and lack of energy and strength. And all those hormonal imbalance symptoms will be the same exactly here in case of low testosterone levels. And lastly, about the eating and lifestyle changes that they can adapt. This is very important question, because on the long term, having a bad lifestyle will lead to a lot of infertility problems. Researchers have shown that we are on a trend of rising male infertility pattern over the past decades, and mainly half of it is attributed to poor lifestyle and as well as and due to environmental factors, because of our, there is something called xenestrogen that is increasingly used by different factories, in manufacturing factories, in such as plastics and parabens in the cosmetics, as well as the skincare products and all kinds of hair products. So these all leads to decrease in fertility. So the lifestyle changes, it can include doing exercises regularly. Exercising have proven to improve reproductive health both for men and women. Increasing in the intake of vitamin D and vitamin C, as well as zinc. Zinc is proven to help in the healthy production of sperms. It has direct role on the production of sperms in the testes. Minimizing stress would be a big factor. A lot of our men, they live in a stressful environment, whether it's in their home or job-related stresses that they take. So these stress and anxiety directly affects the fertility problems in these men. Reducing weight would be also very important in case of those men with raised BMI levels, because as I mentioned earlier, increasing weight decreases the level of testosterone. And avoiding alcohol consumption, quitting smoking, because men who tend to smoke have reduced sperm count and they have decreased motility of their sperm, which in turn will lead to reduced quality of the sperm, and they will be not able to conceive or fertilize the eggs of the female.
Right.
And lastly, addition of food that are high or rich in antioxidant levels, such as fruits or green tea, coffee, or dark chocolate, salmon, fish, and dry fruits. These are very rich in antioxidants, and antioxidants helps in having a healthy sperm and eggs in female. So, and lastly, avoid soy. As we know, a lot of Chinese food contains soy sauce, and any soy products are proven by researchers to decrease the sperm concentration. Now, if you can think about it, these are the common things that we do daily. Like a lot of men would be smoking or even drinking alcohol, or you can having soy sauces, but they don't think about the implication these are having on their infertility on the long term. So these are the things that they need to be aware about. Other factors that could contribute is having a poor sleeping patterns, and that's the thing that they need to focus on.
So any of these conditions, is it permanent? Can this be genetic? Because I believe genetic conditions are hard to treat.
Exactly. There can be a permanent genetic condition, some of which I've already addressed, like the Klinefelter syndrome, in which there is an extra female chromosome. So their testes, basically, they are underdeveloped, and they don't have the capability of producing the sperm from the beginning. Congenitally, when someone have undescended testes, so they, instead of the testes being in its proper position, they are born with the testes in the wrong position. And other conditions that can lead to abnormal functionality of the genital tract congenitally, such as there is a disease called cystic fibrosis, in which a thick mucus is produced that blocks the tube which carries the sperm. So due to that blockage, there is a permanent decrease in the sperm and its whole track into the ejaculation process. Yeah.
As you mentioned, cancer. So I'm going to ask you about prostate cancer, because not many people in Pakistan know this, or if they know, they do not go for treatments, or it is not very well, not a very commonly known problem. So does it affect the fertility rate of men, or has prostate cancer been a cause of infertility in men?
Well, to address your question, I feel that this falls under different domain, because commonly a prostate cancer is seen in older men that are above 50s and 60s, where they are in such a category that they do not require fertility or are not in a desire of conceiving. So a lot of them are already having other health issues, and I guess that is a different topic if we come to our male reproductive health related issue, albeit very important topic and needs to be addressed. It's very dangerous, and for that there should be, once you are at the age where you are increased susceptibility of getting prostate cancer, you'd have yearly or monthly checkup by your urologist to check for the prostate consistency through an examination called digital rectal examination, just to be on the safe side.
All right. So कहने का मकसद ये है कि प्रोस्टेट कैंसर का मेल इनफर्टिलिटी के साथ कोई लेना देना नहीं है, और ये नॉर्मली एक बिल्कुल डिफरेंट डोमेन में फॉल करता है. इनफर्टिलिटी या फर्टिलिटी रिलेटेड डोमेन में ये फॉल नहीं करता. थैंक यू डॉक्टर अमीना. So moving on to our next question, I would like to ask you कि sexually transferred diseases या sexually transferable infections, इनके बारे में आप क्या बता सकती हैं कि किस तरह से ये मेल फर्टिलिटी को इफेक्ट करते हैं या मेल विरिलिटी को इफेक्ट करते हैं, और क्या इनका कोई ट्रीटमेंट मौजूद है पाकिस्तान में, मतलब अगर किसी को हो जाती है खुदा न खास्ता, और क्या कॉन्डम्स इन चीज़ों से बचाने में हेल्प करते हैं या फर्टिलिटी को इफेक्ट करते हैं, other than the obviously condoms are being used to stop conceiving, but अगर उसके अलावा कोई STDs और STIs के रिलेटेड आप हमारी ऑडियंस के लिए बता सकें तो काइंडली बताएं.
Okay, so in regards to infections, it's one of the very important cause in both male and females that it leads to infertility if not treated timely. Infections of the genital tract can be very aggressive. Two of the most common, there can be different causes, but two of the most common bacteria that target the genital tracts in sexually transmitted diseases are the gonorrhea and the chlamydial infection. Now, these can be very aggressive. It can destroy the genital tract tissues and cause fibrosis. Basically, क्या होता है कि जहाँ सारी tubes जिसके through fertility में जैसे sperm या eggs pass होती है, वो सारा चिपक जाती है, उसमें सारा adhesions बन जाती है एक दूसरे के साथ, तो रास्ता बिल्कुल रुक जाती है एंड ब्लॉक, सारा प्रोसेस जो फर्टिलिटी का है वो खराब हो जाती है. इनमें से जो बहुत कॉमन है मेल्स को होते हैं वो ऑर्काइटिस के नाम से है. ऑर्काइटिस बेसिकली इन्फ्लेमेशन होता है टेस्टिस का, तो टेस्टिस का जब इन्फ्लेमेशन हो जाए और वो टाइमली ट्रीट ना हो जाए, इन्फ्लेमेशन की वजह से टेस्टिस के टिश्यू डिस्ट्रॉय हो जाते हैं, डिस्ट्रक्शन हो जाते हैं, जो कि अक्सर परमानेंट होता है अगर टाइमली ट्रीट ना हो जाए. इसका मतलब ये नहीं है कि ये ट्रीट नहीं हो सकता है, इसका ट्रीटमेंट है एंड इट इज 100% क्यूरेबल इन केस ऑफ बैक्टीरियल इन्फेक्शन. बाकी अगर हम सेक्सुअल इन्फेक्शन के पास आ जाए जैसे कि HIV वगैरह है, उनका भी आजकल ट्रीटमेंट है, मगर उनका डायरेक्ट ऐसा इनफर्टिलिटी पे असर नहीं है जैसे कि बैक्टीरियल इन्फेक्शन का इनफर्टिलिटी पे असर है. स्पेशली जो दो बैक्टीरिया मैंने नाम लिए उनका, तो इनमें ये खतरा होता है कि परमानेंटली डैमेज कॉज कर सकती हैं. आपने पूछा कि मेल फर्टिलिटी या विरिलिटी को कैसे अफेक्ट करते हैं. इनफर्टिलिटी को जैसे मैंने बताया ना कि ट्यूब्स को खराब करके, जिसकी वजह से स्पर्म्स की पैसेज को रुकावट आ जाती है उसकी, तो इसकी वजह से इनफर्टिलिटी कॉज हो जाते हैं. सेकेंडली, विरिलिटी इज नॉट रिलेटेड बिकॉज विरिलिटी इज बेसिकली द स्ट्रेंथ ऑफ परफॉर्मेंस इन मेन, तो वो इन्फेक्शन की वजह से ऐसा इफेक्ट नहीं होती एंड हो सकता है बीमारी की वजह से, वरना जनरली इट इज नॉट अफेक्टेड. सो या, एंड अबाउट condoms, basically it is very safe. In no means or in no way it can affect or cause infertility other than the obvious which you mentioned, but it's highly safe and I'd highly advise to use this not only for as a method as contraception but also in preventing any kind of sexually transmitted diseases.
Right. Thank you, doctor, for clearing these issues which are which sound familiar to us, but we obviously lack a lot of information regarding these issues, and for our audience, thank you for clearing this. इसके बाद मैं आपसे ये पूछना चाहूँगी कि आप मुझे बता सकती हैं कि क्योंकि ख़वातीन ने तो काफ़ी दफ़ा ये चीज़ रिपोर्ट की है, ग्लोबली ये चीज़ रिपोर्ट हुई है कि ख़वातीन कहती हैं कि डॉक्टर जो हैं वो उनको गैसलाइट करते हैं, मेडिकली गैसलाइट किया जाता है, उनके पेन को डिस्कार्ड कर दिया जाता है, या उनकी जो प्रॉब्लम्स हैं उनको एज सच उस तरह से ट्रीट नहीं किया जाता जैसे जिस तरह का वो ट्रीटमेंट डिजर्व करती हैं। तो क्या मर्दों के यहाँ भी या मर्दों में भी इस तरह की कोई रिपोर्टिंग पाई जाती है कि जब वो किसी, ऑब्वियसली आई अंडरस्टैंड कि एक तो डॉक्टर्स के पास जाना कम होता है, लेकिन अगर मेन फॉर देयर प्रॉब्लम्स किसी डॉक्टर के पास जाएं भी, तो क्या उनके साथ ये गैस लाइटिंग वाला प्रोसेस होता है? और अगर होता है तो उन्हें क्या पता होना चाहिए कि वो अपने आप को वेल इक्विप कर सकें जिस ट्रीटमेंट के लिए वो जा रहे हैं, उसके बारे में तमाम इंफॉर्मेशन हासिल कर सकें? काइंडली इस पे जरा रोशनी डालें।
ठीक है, I guess in all of our topic today conversation, this is the most important question and this is the most important aspect, because we need to address this issue, and to address this issue we need to find out what is causing this issue. And being in a like I have a lot of exposure with female infertility, I can see the effect that male infertility and the ignorance about the male infertility has on the females. The females are highly disregarded when it comes to infertility issue, in a sense that they're always targeted. Their feelings, their emotions, everything is disregarded just because the males would not get checked up. So the problems the men face are quite opposite than what the women face. Due to the pressure of the society, the in-laws, we tend to receive women at our infertility clinic as even early as 5 months after marriage. So women, we have noticed that women seek out help very soon because they are pressured for it. They're pressured for concerns of infertility by the society. So whether gaslighted or not, they do come forward and try to be on the safe side. So that's a good thing about women. Now, the thing is, with men, there is a greater stigma, even for simply visiting a urologist for any infertility concerns they may have, and this fact is not discussed enough. We need to normalize men getting checked up for fertility-related issues. And once men come to terms with that and normalize that, then only women will get the sigh of relief that they are not alone in this fight, in this journey of infertility, and they can be together with the men. So one of the reasons for this that I believe that needs to be addressed is that for men, the standard of being masculine is defined by how sexually active and virile they are. Some men confuse infertility with the issues relating to sexual problems, and they are not necessarily intertwined. So you could be sexually active and well performing and virile, but at the same time you could be suffering from infertility related issues. So men can have infertility issues, so this needs to be addressed, and it needs to be differentiated. Now, this wrong concept of masculinity prevents men from seeking medical care, because they are in fear of being shamed and getting their masculinity and sexuality questioned. So hence, most men, what they do, they are unwilling to come forward for testing, which further delays the diagnosis and treatment and loss of a precious time. On this note, I'd like to mention a story that recently happened with me. A few days back, I had a patient who was keen to conceive for the past 10 years. For 10 years, she have had every kind of test you can imagine, procedures, invasive procedures, laparoscopy is done, whatever you can imagine, she had done it. She had a bundle of file with her. And when she came to us, I asked her, do you have any semen analysis of your husband? She said, no. And I was like, in those whole 10 years, you have not had your husband checked? He said, no, he refused to get checked. We asked the husband to come and we counseled the husband in regards to the whole process of how fertility works. We showed the husband every test of his wife, how everything is normal. Every test was normal. And we asked him that there may be slight possibility, a slight chance that there could be something wrong with his sperms. At first, he denied it. He didn't take it lightly, and he did not like the idea of being tested, especially not in front of his mother-in-law and the family. So, but we convinced him eventually, and he got tested. And to our surprise, he actually had a low sperm count. Not only that, he had decreased motility and a high number of dead sperms. So the problem was with his sperm count. The thing about this is that once I told this report to the wife, the bittersweet feeling, the sigh of relief, she was crying and smiling at the same time as if a burden was lifted off her shoulder. For 10 years, she carried this burden, this blame of infertility, not being able to conceive, this gossiping alone, while the whole problem was with the husband. Imagine the precious time they lost. If only the husband had gotten tested on time, they would have had probably 2 children by now. But because of this male ego, this wrong concept of masculinity prevented him from being tested, resulted in such a waste of time. My heart broke for that woman. To be honest, it was one of the saddest moments of my clinical experience. 10 years is a lot of time, and a lot of time to carry such a heavy burden alone, broken, blamed by everybody. I can't even describe that moment I had with that patient. So, well, my point is that male infertility contributes to 30 to 50% of the cases, and even it is on the rise.
Right. Thank you, Dr. Amina, for sharing your story with us. I think that will be an invaluable experience for those who are going to hear this. Because if you are facing issues, then I think you should not hesitate to get tested, because it is not about your ego. It is about your health. It is about your life, your time, and everything that you can imagine. So just put your ego aside if you want to live a healthy life, and if you want to get diagnosed as early as possible. And without diagnosing the problem, I know, and I think people will agree to this, that there is no solution without diagnosis. So unless you're not going to get diagnosed, you're not going to get help. And if you're not getting help, you're not going to get anywhere. So starting with your diagnosis, anyone who's listening to this podcast should be coming forward to get help for their problems. And I hope आपकी जो स्टोरी है, ऐसा कोई दूसरा शख्स इस तरह का बर्डन ना फेस करे, चाहे वो मेल हो चाहे वो फीमेल हो. सो थैंक यू डॉक्टर फॉर शेयरिंग द स्टोरी. आई थिंक पीपल विल लर्न फ्रॉम दिस. फैमिली प्लानिंग के लिए ज्यादातर खवातीन को टारगेट किया जाता है, मतलब उनके लिए बर्थ कंट्रोल पिल्स होती हैं या और इन्वेसिव प्रोसीजर्स होते हैं. लेकिन क्या मर्दों के लिए कोई और प्रोसीजर अवेलेबल है पाकिस्तान में जो कि बर्थ कंट्रोल के लिए यूज किया जा सकता हो? अगर है तो आप काइंडली मुझे जरा डिटेल में बता सकते हैं तो प्लीज बताएं.
Okay. So you're right about that. Females are the main target for family planning activities. As for men, commonly the most two methods are used, either condoms or spermicides. Along with the condom or separately, the spermicides are used. But other than these two methods, the only other permanent solution is vasectomy, but it's sought out by men. Other than that, withdrawal methods are also used by many couples, in which instead of ejaculating inside the vagina, they withdraw before the ejaculation happens. So that is also one of the methods employed by men. But other than these three main methods, there are no family planning method targeting men. Even the research are going on these days about trying to make tablets or pills for men as well that could be taken daily or regularly, such as females. But as of today, other than these methods, there are no methods that could be employed by men for family planning or contraception.
Right. So can you please highlight what is vasectomy, and is it reversible, or are there any side effects of this procedure, and how can it be done, and where could it be done?
Okay. Okay. Vasectomy, basically, it is a minor procedure. It is a minor surgery. In order to understand vasectomy, you need to know about the male genital tract. So the sperms are made in the testes, and then there are tubes connecting the sperm to the penile shaft. So the tubing that connects the both, basically that is cut and sealed so that the sperm, when it is made, it cannot go and join the seminal fluids. Those are basically the fluid that is released during the ejaculation. So the fluid that is made basically in the prostate gland, that is combined with the sperm, and together they form the whole ejaculatory water. Now, in the vasectomy, the tube between the testes and the penile shaft, it is cut and sealed, as I mentioned. Very minor procedure, highly effective. Minor side effects, there are basically 0 to none side effects, and it is very efficient as a method of contraception rather than any method that would be used by women, because all the methods that are employed by women have some sort of side effects that can be severe to minimum, but there is always some kind of side effects. But the vasectomy is such a procedure that is safe, effective, very efficient, can be carried out during a daycare visit to a urologist.
Is it reversible if someone wants to have kids in future, or they want to undo the procedure? Can it be done?
Okay. Well, the thing about vasectomy is that it is possible to reverse it, but it requires very high expertise. It is intricate process, and this is it could take from somewhere around $3,000 to $15,000, and there are not many people that would be able to do it, especially here in our setups. Vasectomy itself. Could you hear me?
Is it safe to say कि चूंकि इसके रिवर्स करना इसको थोड़ा सा डिफिकल्ट है, इसलिए जो मेल्स हैं वो इस प्रोसीजर की तरफ नहीं जाते, और अगर ऐसे मेल्स की बात की जाए जो कि परमानेंटली, जो कि फ्यूचर में बच्चे नहीं चाहते, वो अगर इसको करवाएं तो उनके लिए कोई साइड इफेक्ट नहीं है, चाहे वो किसी भी एज में करवाएं?
जी, साइड इफेक्ट तो बिल्कुल नहीं है. इट इज द सेफेस्ट एंड मोस्ट एफिशिएंट. उसके हिसाब से कोई मसला नहीं है. अगर इवन आफ्टर डूइंग वेजेक्टमी अगर किसी को बाद में बच्चे चाहिए तो उनके लिए एक और तरीका है जो कि इंट्रायूट्राइन इंसेमिनेशन, जैसे पहले मैंने बता दिया. वेजेक्टमी क्या होता है, इसमें स्पर्म्स बनती है, स्पर्म्स का प्रोडक्शन में कोई असर नहीं आता. वो तो क्योंकि रास्ता बंद किया हमने, तो उनकी they cannot go through the ejaculatory fluid. However, they are made in the body and they are soaked up by the body because it is not utilized. So they just die out. So if you still want to have children, फिर इंट्रायूट्राइन इंसेमिनेशन में जहाँ से टेस्टिस से स्पर्म की सैंपल ली जाती है, वो डायरेक्टली फीमेल की यूरिनरी ट्रैक्ट में इंसर्ट हो सकता है. और योर नेक्स्ट क्वेश्चन वाज,
जाती है तो doing vasectomy, is it cheap or is it easily accessible?
It is easily accessible and it is cheap. It is not that expensive, given that it gives you a lifelong contraception. But research was carried out in Lahore by a very renowned urologist, and he actually carried out vasectomies in Pakistan. तो उसने रिसर्च में ये देखा कि जो लोग जिन्होंने रिजेक्ट किया वेजेक्टमी का, उनका कॉज बेसिकली रिलीजियस था. So they had religious doubts about whether it is halal to undergo vasectomy and permanently stop the process of having children. So this is one of the main concerns that they had, and they wanted a very prestigious Sharia fatwa from somewhere in order to be convinced to be able to do it. Otherwise, they wanted to do it. And so, yeah, mainly this was the cause. The second most common cause was that they were afraid of being shamed into thinking that after vasectomy, they would be considered less of a man, like as we mentioned before, a matter of masculinity, basically. So These were the two most common causes that men rejected the process.
Right. So we're coming towards the end of this session, and I'm really glad that we had you today, because you have highlighted many of the issues that most people in our society have little know-how of. So coming to our last question, I would like to ask you, how can we normalize these conversations in our society, particularly a society like Pakistan, where social, religious, and cultural norms are such that they prevent these kind of discussions, or somehow, although religion does not do it, religion asks us to seek help, and religion asks us to be as aware as we can be, but social norms and social constructions that we are living under today, they somehow bind us into staying, I would say, as pious as we can be. So how can these conversations be normalized without making it difficult for people or without making it vulgar, in other words?
Okay, so at the end, this is the very important end message that we could actually deliver to our audience. So in order to decrease the stigma around the male reproductive health and infertility, we need to start conversation around male infertility, a holistic approach that involves the private and government hospitals, general public, social media. These conversation needs to be made. For example, even a simple information sharing, as we are doing right now, could go a long way in changing the mindset of the public. You might have noticed that there are some female celebrities that commonly or like openly talk about their infertility issue. This encourages the awareness in normalizing getting checked up, but the same should go for men, and the men should speak out about male infertility issue in order to encourage other men to get checked and consider this as a normal issue. And people tend to have this ideology that if some public figure is doing it, it indirectly affects their mentality. So this is one of the ways that we could do it. And other than that, public speaking about male infertility, whether it is in talk shows, in morning shows, YouTube channels of famous YouTubers, or in many men, after spreading such a news everywhere and raising the awareness everywhere, many of the men will start to have courage and start to feel, okay, this is normal. I'm not alone. Everybody's facing this, or there's a lot of men going through this, and they will start to have this sense of normalcy that I need to get checked up, and this has nothing to do with the ego or masculinity. It's two different issues, like any other health issues that you would have. So this is one of the very important point that needs to be highlighted. On our part, being a healthcare professionals, for these men to get checked up, and men who do in the end get courage to go visit a doctor, we need to provide an easy access, a welcoming environment, and be understanding of their situation. So this will also help other men to not shy away and present timely when they have any kind of issue related to infertility.
Thank you, Dr. Amina. Thank you very much for your time, for you being here and giving us time and providing us much needed information on a very difficult to talk about topics. Thank you for your time. Thank you for your presence. And I'm really appreciative of your effort to spread the message and to spread awareness for people who really need it. Thanks again. Take care.
Thank you so much. And as a last message, I would love to mention this thing that when to see a doctor. For men, I'd like to just focus on this point. If you have any kind of erection problem, ejaculatory problems, any kind of sexual problems in your relationship, any pain or discomfort in the testes or scrotum area, or inability to conceive after many proper attempts, please seek out a urologist. In private, you don't have to tell anybody, just muster the courage to visit a urologist. That would be the end message of this podcast.
Thank you very much, Dr. Amina. Thank you so much for your time.
Thanks.
Take care.
So
God bless.
Thank you.